I think the reason why I wanted to go into knee surgery more than any other part of the body is that it's a really nice mix of surgery and a really nice mix of patients. So we deal with young people with sports injuries who we can do clever keyhole surgery on to help them with ligament reconstruction or meniscal tears, all the way through to older people who are now struggling with some arthritis, and you've then got the opportunity through either a knee replacement or an osteotomy to give them a sort of a new lease of life and really help them enjoy their retirement and old age and give them back that sort of spring in their step. So it's the whole spectrum of surgery and the whole spectrum of patients that appeals to me. Oh, there's no question about that. I think any doctor would tell you the best thing about the job is when you see a patient come back to follow up and they've got back to whatever it was they couldn't do, or their pain has improved, or their quality of life is better, and you just feel that sort of nice sort of fuzzy feeling of having done a bit of good. I think the most difficult thing about orthopaedic surgery is the patients who have got premature wear and tear, premature arthritis, in whom sometimes the only advice you can give them is how best to manage their symptoms, and you can't really offer them a complete cure. We do see problems in 30, 40-year-old patients who, if they were much older, they might be a good candidate for a knee replacement. But a knee replacement at that young age, may fail on them, and then you've sent them down the route of endless more surgery, which probably isn't in their best interest. Stage of our life at the moment. Our children are 9 and 7 now, so they're pretty independent and very active and keen to be involved in everything. So probably like a lot of parents of young children, weekends are, it's a bit of ferrying around being done, but we get involved. I play tennis with my daughter, and I coach rugby at Roslyn Park, mini rugby for the little boys, for my son Will and his peer group. And I used to play a bit of rugby myself, so that's really good fun to sort of bring the next generation on. We got lots of family and friends, and we try to catch up with them whenever we can, lunch and dinner, and I like a nice walk with a dog, and lunch in a pub afterwards, just normal stuff really. In holidays we ski and try and go down to the West Country for the beaches in Cornwall and Devon and stuff.